Dear friends, colleagues and patients, very welcome to today's Swiss Biohealth news. We're going to have an amazing, very interesting interview guest for today's Swiss Biohealth news. It's Professor Yehuda Shoenfeld, the leading mind in immunology and autoimmune disease. Tomorrow, our guest will be Marco Gadola, the former CEO of Straumann, the world market leader in dental implants, and voted number 2 most influential person in dental industry. We are going to, we hope we are going to receive some insights how the economy, especially for us dentists and clinicians, could develop in the coming weeks, months, and years. On Friday, our guest will be Professor George Birkmeyer. He's the founder of the coenzyme 1. So this will be very, very interesting as well, and giving us a great insight how to improve our energy and our health. Let's have a quick view to the pandemic situation, and we see from left to right, it has improved. There's still just one red spot left. It's Turkey, but you see all the others are in the green and yellow and orange zone. And for us, the doubling rate is the most important number. And we see Italy, Switzerland, and Germany, they go straight up. As well, the US, even there are some weeks behind, they go up quite nicely, and they've already reached 4.1. Just France is a little bit on the side way direction, so we hope they're going to close up in the coming days. Of course, if we are talking about the mortality or let's say the infected people or suffering from SARS caused by COVID-19, we have to compare it to the SARI cases, that's the severe acute respiratory insufficiency, which we observe every single year. We have to compare it to the years before, and as we can see, so the gray zone is always the same than every year, and we see 2 years ago in January 2018 it was very, very high. So this is was the very bad and severe flu, where just in Germany 25,000 people died. And last year in 2019 we see it was much lower, the numbers, maybe just 50%. So it was kind of a good year regarding the seasonal flu. And actually we see what is quite astonishing, that this year it's even lower than last year. And as we know, the COVID-19 is is a SARS virus. So it's quite interesting that the numbers are even lower than last year, what was a good year. And so we will see, maybe it's going to turn out after a while, when we are going to have a retrospective view onto the whole thing, that of course may be caused by the measures that were taken by the governments all around the world, that we had actually a very good year. Some more news. Slovenia is the first country in the world which will not introduce 5G, and at least for the moment. As well, they have decided, it's as well as the first country in the world which has started to protect the water as a public good. So that's very interesting, and we will see and closely observe if maybe other countries are going to follow. Let's have a look at the economic situation. We see the gold goes down a little bit, so it might be a good idea or a good moment to buy some physical gold. The Dow Jones goes sideways, and I think regarding the economy, there are two things we have to consider. One thing is that, of course, at least in Europe, a lot of companies are going to go bankrupt, and this is going to discontinue the supply chain, maybe for bigger companies. And as well, the question is if those companies which are going to go bankrupt, if they will be bought by foreign companies, by investors from other countries. So this could be like we could lose not just companies, but as well knowledge and production places to other countries. So this is one, I think, possible severe impact onto our economy at the moment in Europe, in Germany especially. And the other thing is that all the governments in Europe, they have promised to help out those companies. They had to stop their production, and this, of course, for that they have to print a lot of more money. And the thing is, since our money is not any longer based on gold, of course we could print as much as we like, but the point is that there is a given amount of goods, and if we double the amount of the money, but the amount of the goods is still the same, of course there will be an inflation, because you will have to pay this amount of money for this amount of goods to make it easy. And this is definitely going to cause inflation. And but it's even worse because the amount of goods goes down and shrinks due to the shuts down and due to the lockdown. So the ratio between the goods and the money is becoming even worse. So this is something we are afraid of, that it could finally cause very strong inflation, and we are now working hard in getting some specialists and experts about economy into our Swiss Biohealth news. But in general, I believe it's good to invest, of course, to have some money for the coming, not on a bank account, but for the coming months. And as well, I think it makes a lot of sense to invest some money into goods you could later use to run your business. So in a clinic, we would, of course, try to have everything in stock. What do we need to treat our patients? But now let's move forward to our guest of today, Professor Yehuda Shoenfeld. You could see he's the top expert in autoimmune disease and immunology, and he published more than 1,300 scientific publications. So we are very excited that he agreed to talk to us today. Now we're very pleased, and we very much welcome Professor Yehuda Shoenfeld. Good morning, and thank you very much, Professor Shoenfeld, for joining us for this video interview.
It is my great pleasure.
I've met you 3 years ago at the Membrane Congress in London, organized by our mutual friend, Professor Steiskal. And looking back, two distinctive things have stayed in my mind. So firstly, the importance of shaping the immune system at birth. Children that are brought into this world by C-section should get kind of vaccinated with the vaginal flora. You told me that this vaccination was forgotten with your grandchildren, and so you let the dog and the horse do the job.
Correct. But let me emphasize that what the hygiene theory actually has told us is that we should not keep the children in a complete hygiene, because those children who were born in farms and out of the cities and were exposed actually to dogs, cats, and other animals, they were less suffering from allergic diseases as well as from autoimmune diseases. Moreover, in our studies, we were able to summarize the geographical distribution of autoimmune diseases as well as allergy. And we have found that the further you go from the equation to the north and to the south of the globe, the higher is the incidence of autoimmune diseases. So in part, it can be explained by the level of vitamin D and UV ultraviolet exposure. But by and large, the main cause is the distance that we have developed from our friends, the worms, the helminths. And actually, this led to a large series of studies to see if we can harness again the worms, the helminths, to treat autoimmune diseases. And even we have developed a compound from the helminth, which is called TPC, which is the active part that the worm, which lives in our body, mainly in the gastrointestinal tract, secretes to immunomodulate the immune system of patients with autoimmune diseases. So as we can see, when you are a child, and actually when you are born, is extremely important to print your immune system. And therefore, people who are, or children who are born by cesarean section, they are more prone to allergy and autoimmune diseases in comparison to children who are born through a normal vaginal delivery.
I think this is very very interesting. And when I think back about 50 years, my mother always, she told me a healthy boy has to kind of eat 8 pounds of dirt in a year, something like this. So she was never afraid of getting us some dirt from the nature. And so this would be exactly what you were saying.
It's true. Actually, when you say to eat, when my granddaughters, and I have 3, when the pacifier from their mouth is falling down on the earth, we don't clean it. We give it back to their mouth. So you are absolutely correct.
Okay. And I liked what you were saying, that because this is exactly the second thing what stood in my mind. Another 2 slides, you showed the decreasing prevalence of diabetes and autoimmune disease once you go closer to the equator. And as well, you showed, and actually I took a picture of those slides, and since then I'm showing in all my lectures. But I'm quoting you and your findings, of course. And the second thing was that you showed the increase of UV radiation and increase of the calcidiol towards the equator. And you showed a map with the vitamin D levels all around the world. And it's quite interesting that it reflects more or less the incidence to the start of the COVID-19 pandemic. So do you believe that?
So you are absolutely right. And this brings me to the importance of vitamin D, like David with D.
Yeah.
And it seems like there is an inverse correlation between the level of vitamin D in the blood, the incidence and severity of almost all autoimmune diseases. And one of the reasons is that vitamin D has about 400 beneficial effect on our body and especially on the immune system. Actually, one of the reasons that we have more respiratory infections also during the winter is because we are less exposed to the sun and the level of vitamin D is low. And this pertains to nowadays to the actual issue of the coronavirus. We believe also that the vitamin D may help to reduce infectivity of the coronavirus. And therefore, I would recommend everyone among our listeners to take 2,000 units per day, which means one tablet of 2,000 or two tablets of 1,000 every day. Actually, at this level, you have no side effect. It's quite cheap, and actually you don't need a prescription of a physician. And this is a great benefit of taking vitamin D. Myself, I take it, and every patient who enters the door of my office is recommended to take vitamin D 2,000 units per day.
It's great to hear you talking about the vitamin D3 because 2 days ago I interviewed Dr. Hollick from Boston. I strongly believe that you know him.
The guru of vitamin D.
Yes, exactly. It was very, very interesting. If you like, I could send you the link to the interview. It was amazing, and he was telling us exactly the same, that we should, especially in those days of Corona, we should go on a daily basis for a supplementation of vitamin D3. And so what is your opinion about getting vitamin D3 from supplements, let's say 2,000 units per day, but on the other hand, exposing ourselves to the real thing, to the sun? So is it even better to sit in the sun?
It's true that we are developing the vitamin D by exposing ourselves to the sun. And it's true that in the modern life, even in a very sunny countries, like my country, Israel, we are not exposed to the sun. Most of the time we are in rooms, in shaded places, and we actually hide from the sun. Most probably, the exposure to the sun have also side effects. One of them is the aging of the sun. You can recognize people from sunny places because they have more wrinkles in their face, like those who are smoking. But also there are some dangers of developing malignancies like melanoma and basal cell carcinoma, which are two skin cancers. And indeed, in Israel and in Australia, which are two countries with the highest exposure to the sun, you have the highest incidence of melanoma and basal cell carcinoma. So luckily enough, the industry has supplied us with vitamin D in tablets. So it is much more easier to take one tablet instead of staying hours in the sun with all the, I would say, deleterious effects or side effects. This does not mean to say that you need completely to avoid the sun, but to do a ceremony which the Indians have done in United States, exposing yourself to the sun, you don't need it. So it's preferable to take a tablet rather than to expose yourself to the sun.
When I was talking about this with Dr. Hollick, he told me that beside by building the vitamin D3 on the skin by exposing ourselves to the sun, of course we should never get sunburned. That's the most important rule. there should be some other positive effects of the sun to our immune system. And as well, his idea was that the melanoma is quite often seen in places in areas of our skin, of our body, which have never been exposed to the sun. So as well, I remember a meta study that showed that with a low level of vitamin D3, the patients had a higher risk for cancer in general. So what's your opinion about that?
Okay, so Professor Hollick is really the guru of vitamin D. And if I would say he knows everything about vitamin D, we had even several congresses that we appeared together on the subject. There are some studies showing also the inverse relationship between vitamin D and cancer. But I would simplify it for our audience. Vitamin D is good. Side effects are very, very rare, especially if there is somebody with renal failure, kidney failure, that he may develop high level of calcium. But by and large, it's very, very rare. Therefore, to simplify it, it's better to take one tablet of vitamin D, 2000 units, rather than to complicate it with smearing vitamin D, with exposing yourself. So better to do it in this way.
Okay, so what in your opinion should be the target value in nanograms? Should it 40 to 60 or 60 to 100? What would be your idea about the target value?
I think that this is a kind of problem because when you do it, there are not very good measurements of the vitamin D, and they are different units that they use to determine the level of vitamin D in the blood, whether it's nanogram or units, etc. I don't measure the level in the blood. I recommend to take it and rely on it, that by taking it, you increase it to a better level that was before you were exposed to the tablet. That's very simple and not to complicate the issue.
Okay, just to keep things simple.
Yes.
Okay. Another question, Professor Schoenfeld. So what is your and your family, how do you protect yourself against the virus? Is there anything else besides the high level of vitamin D3?
I do take vitamin D with or without the coronavirus, and with the hope that it may help to prevent the infection or to reduce the infectivity of the virus. However, I think that the best issue is what they do in Japan and in China, and this is to wear the masks. The masks are important once that you will not be infected with a droplet infection, but also if you are infected and you don't know because you are asymptomatic, you protect other people from distributing it. And
Yeah.
indeed, it is amazing that in China and in Japan, just by wearing routinely the mask, a simple mask, it doesn't have to be the most sophisticated mask, you can very effectively reduce the distribution of the virus in the population. So I would say masks wherever you go. The second point, it's, as you can see, I have some white hairs. So it means that I am at the risk age, as you can imagine. But I would recommend people at the third age to limit the contacts in these, I hope, 2 or 3 months until we will be able to combat and to reduce the appearance of the virus. So these are, in my opinion, the two most important things. If you want to hear about a dietary recommendation, I would also recommend curcum, 1 gram per day, which is also, you don't need a prescription, and it has a lot of beneficial effect on our immune system. And otherwise is to keep, your mouth shut, because once you are in the house in isolation, you eat too much and it may affect your blood pressure, your diabetes, and also your figure. So I would say vitamin D, mask, curcumin, and keep your mouth shut, and a kind of isolation.
A general question, what do you think, how dangerous is the virus actually? Is it just another flu virus, or is it a very dangerous because it's a SARS virus? Or do you think maybe we are somehow, especially in Europe, kind of overreacting a little bit?
The fact is, that too many people are dying. It's true that mainly at the third age, mainly people who may have associated clinical conditions, etc. Having said that, if you compare it to the influenza, the regular common cold, it's very similar. In every country, hundreds and thousands are dying every winter from the influenza. So we will be able to analyze and to compare the two viruses only retrospectively. Namely, once the epidemic will discontinue, we will be able to make analysis and to compare the incidence of infectivity, the incidence of mortality, morbidity between the two infections. My feeling is that they might be very similar, but we will have to wait and to see. My feeling is that it is a little bit more infective. And what happened is that once your immune system is lowered or reduced, you may develop what we call the respiratory involvement, the pneumonia, the infection of the lungs. And then you develop something that we rarely see in a regular influenza, which is called a cytokine storm. It means that there is an activation of macrophages, the cells of the immune system, and they produce large amounts of actually protective agents, which are called cytokines. But they are so much that they cause actually such an inflammation that all the organs, tissues, and systems are collapsing. And that's why I have recommended to use IVIG, intravenous gamma globulin, because we know this situation of cytokine storm. And currently I read quite extensively that in United States they are using it, also in our country. So by understanding better, it seems that the coronavirus is another kind of influenza, but with a more infectivity and pathogenicity than the regular influenza. But we will be able to analyze it only retrospectively when the epidemic will actually be diminished.
Could it be as well that, let's say, humanity year by year, our immune system becomes weaker, and due to stress and the environment, we are more and more already in a kind of a pro-inflammatory modus, and so we are more responsive for the cytokine storm?
So you may be right, because when you become older, your resistance become older too. It's like an old machine. But it's not only the pure age. When you have additional diseases like diabetes mellitus, we know that patients with diabetes have a higher incidence of different infections. urinary tract infection, skin infection, etc. So definitely, there is also contribution of the associated conditions. So if we have somebody at the age of 85, but he is a marathon runner, I'm not sure that he has a less effective immune system than somebody who is 40 years old who runs the marathon, if he doesn't have hypertension, if he doesn't have diabetes mellitus, and so forth. Needless to say that smoking might be one of the deleterious effects. We know it also in subjects who are exposed to the regular influenza. So when there is smoke, which means, the fog in our cities, there is an avalanche of death cases of patients
Yeah.
who were smokers and have chronic obstructive lung disease. So I
Yeah.
hope that I answered your question. They are similar, yet the corona is more infective because of the cytokine storm, and we will be able to make the calculations. How many were infected? How many were hospitalized? How many died in a season only after we will finish, or we will be able to completely eliminate the coronavirus.
Since you're one of the leading minds regarding autoimmune disease, I, as a biological dentist, I would like to ask you about the impact of dentistry into autoimmune disease. I mean, we know that toxins and heavy metals are altering the major histocompatibility code, and switching a self cell into a non-self cell. So what is your idea? I mean, we've got a lot of biological dentists in our community. What is your message to biological dentists regarding autoimmune disease in general?
So thank you for asking me this question, because we met at the meeting in London where the late Vera Stayscale has organized it.
Yeah.
She was wandering in all the countries in her lecture with a dentist, and she wrote extensively about what we know today, the syndrome which is named after my name, Schoenfeld syndrome, the Asia syndrome, which is an autoimmune syndrome induced by adjuvants, something which stimulates the immune system. It has been found that aluminum, but also other metals, are instrumental in stimulating the immune system. If incidentally it happened in subjects who have already overreactive immune system, those who are prone to develop autoimmune diseases, it may develop at the beginning to the Asia syndrome and eventually to a full-blown characterized autoimmune disease. Therefore, it has to be our aim to reduce as possible the amount of metal in our body, being nickel, titanium, aluminum, etc. And luckily enough, the modern dentistry is employing less metals, more other substances which most probably are inert to the immune system. However, the dentist, they are physicians. They have to be aware of a patient who complained about peculiar manifestation, as was described by us in the Asia syndrome, and to see if the patient has an old filling, teeth filling, which are composed of metal, and to recommend to replace them with the new acrylic substances, etc. We will have our 12th Congress of Autoimmunity in Athens at the end of November, and several of the sessions will be dedicated to the issue of dental fillings, of metal, and autoimmune diseases. And my honor will be if you will attend this meeting, and I will be able to prepare for you a coffee and maybe even to raise a glass of wine for our discussion today. Thank you very much.
It would be my pleasure, of course. Thank you so much. And in exchange, I would like to invite you at the beginning of November, if your schedule would allow it. We are going to organize a congress here in Switzerland at Lake of Constance. It's close to Germany and Austria, where we are going to invite all my interview partners, like Michael Hollick and many others, to bring all the knowledge together. So we are going to stay in contact and see if you could make it to Switzerland at the beginning of November. That would be really great.
I do my best. Send me by email the invitation, and I definitely will respect you and take the advantage to deliver the talks in your meeting. Thank you very much. It was a great pleasure to see you and to talk to you.
Yeah, thank you. It's the same for me, and thank you for your precious time. Stay healthy and hope to see you soon. All the best.
Thank you very much. Bye-bye.
Thank you. Bye-bye. I believe we have received amazing, incredible insights from the, I would say, best mind in autoimmune disease in the world, and especially the last question when he informed us about his ideas about the importance of metal-free dentistry was, I think, very interesting, and another proof that we are on the right path in what we do and providing a metal-free dentistry now since more than 20 years. And I've invited him to participate at our Swiss Biohealth Health Days at the beginning of November here in Kreuzlingen in Switzerland, and where we are going to bring all those great minds together who were taking part at our Swiss Biohealth News interviews. So most of my interview partners, they've already confirmed the dates, so it's quite sure that it's going to happen. And so thank you so much for being here, for listening this evening, and have a great evening, and see you the coming days. Bye-bye.